I'm Dr. David Hill, and today we're going to be talking about the common cold in newborns. Now, the good news is that while anybody can get a common cold, including a newborn baby, it's not all that common in newborns. Why is that? Well, they're often protected from colds to some extent by the mother's own antibodies that are in their bloodstream when they're born. It's possible that breastfeeding, because it gives the baby some more of the mother's antibodies, may further protect the baby from the common cold. That said, newborns certainly can get colds. They're going to start with the same symptoms as anyone else: a stuffy nose, runny nose, an uncomfortable throat, maybe a little bit of cough. That said, newborns are certainly at higher risk for significant complications. One of the nastiest diseases we see is respiratory syncytial virus. There are some other viruses that are not named respiratory syncytial virus, RSV, but behave just like it. These viruses cause wheezing and shortness of breath, especially in newborns. So if you see that your baby seems to be breathing too fast, is working hard to breathe using his or her belly muscles, if you see skin pulling between the ribs or under the rib cage or over the top of the rib cage, if your baby is making a little grunty noise, a little with every breath, or you see the nose flaring with every breath, those are signs of real breathing problems, and your baby needs to be seen immediately, sometimes even hospitalized for that. Likewise, if your newborn's nose gets too stuffed up, he or she may not be able to breathe. They have to breathe through their noses at that point in life, so you really want to look out for that. You can make some saline solution to clean the baby's nose out. You could use a half a teaspoon of salt in a cup of water, boil it so it dissolves, and then let it cool back down to room temperature. And you can use a little suction bulb or medicine dropper to put a couple of drops in each side of the nose. It's going to make your baby really mad, by the way, but that's okay. It's for his or her own good. Then use a little suction bulb to get that stuff back out with the mucus. Usually that will help your baby breathe through his or her nose, at least enough to get a good feed in and rest comfortably for a little while. Now, if you have a newborn, that is a baby under 3 months of age, who has any fever at all, a rectal temperature greater than 100.4 degrees Fahrenheit or greater than 38.0 degrees centigrade, that baby needs to be evaluated immediately. That's an emergency. I don't care if he or she has a cold or not. A doctor needs to get a look at that baby. That fever may be a sign of a very serious illness. Talking about cold symptoms in newborns, I'm Dr. David Hill.